This is the circulatory system by Kyla Cachola. The circulatory system is made of blood vessels that carry blood away from and towards the heart. The circulatory system carries oxygen, nutrients, and hormones to the cell. This system removes wasteful products like carbon dioxide. Let's move on to the main organs of the circulatory system. Its main organs are the heart and blood vessels like veins, arteries, and capillaries. The heart pumps through the network of arteries and veins. The heart constantly receives signals from the rest of the body that direct how hard it needs to pump to properly supply the body with what it needs. The superior vena cava carries oxygen-poor blood into the heart. The aorta carries oxygenated blood from the heart to the organs and tissues. The circulatory system is made of two independent networks that work together called the pulmonary system and the systematic system. The other main organs are blood vessels like veins, arteries, and capillaries. Veins carry oxygen-poor blood to the right atrium of the heart. The blood is then pumped through the right ventricle, then through the pulmonary artery, which splits off into two and divides into increasingly smaller arteries and capillaries before entering the lungs. The tiny capillaries form a network with the lungs that facilitate the exchange of carbon dioxide and oxygen. From the lungs, oxygen-rich blood flows back to the heart. Arteries carry oxygen and nutrient-rich blood from the heart to all parts of your body. Capillaries are the smallest type of blood vessel and provide the bridge between arteries and veins. Maintaining homeostasis. To help maintain homeostasis, the circulatory system regulates and maintains the correct levels of nutrients, oxygen, and waste products needed by the cell. The circulatory system delivers oxygen and nutrients in the blood to the surrounding cells to maintain homeostasis. The blood in the circulatory system is needed throughout the body so that other systems work properly. Like for instance, the nervous system has the brain, and the brain needs blood to function. The circulatory system works with the digestive system because blood takes nutrients from the broken down food and transports it to where it needs to go. The circulatory system works with the respiratory system because lungs give oxygen to the blood to be carried through the body, and blood gives carbon dioxide to the lungs to be exhaled out of the body. Now here are some diseases or disorders of the circulatory system. One disease is a heart attack. A heart attack occurs when not enough blood reaches your heart. This can happen due to artery blockage. Heart attacks damage the heart muscle and are medical emergencies. Some symptoms are pain in the center or left side of the chest that feels like mild or severe discomfort, pain that radiates from the jaw, shoulder, arm, or across the back, and nausea. Women often experience heart attacks a little differently, with pressure or aching in their backs or chests. Doctors should screen you during regular physical exams for risk factors that can lead to a heart attack. If you're in an emergency setting for symptoms for a heart attack, you'll be asked about your symptoms and have your high blood pressure, pulse, and temperature checked. You'll be hooked to a heart monitor and have tests to see if you're having a heart attack. To treat your heart attack, you have to take medications such as aspirin, thrombolytics, antiplatelet agents, pain relievers, beta blockers, etc. You might have to do surgery to treat your heart attack. Approximately 25% of patients die from a heart attack. 25% will die within the next 2 years. Every year, about 805,000 Americans have a heart attack. Another disease or disorder of the circulatory system is a stroke. A stroke is a sudden interruption in the blood supply of the brain. Most strokes are caused by a blockage of arteries leading to the brain. Other strokes are caused by bleeding into brain tissue when a blood vessel bursts. Symptoms are feeling numb or weak in the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking, seeing, walking, dizziness, and severe headaches. Your doctor may use head CT or head MRI to help diagnose your condition. Other tests may include blood tests, electrocardiogram, or carotid ultrasound. Treatment depends on the type of stroke. For a hemorrhagic stroke, you have to go through emergency measures, do surgery, surgical clipping, surgical AVM removal, and stereotactic radiosurgery. For an ischemic stroke, you have to take emergency IV medication. You also have to go through emergency endovascular procedures like medications delivered directly to the brain or removing the clot with a stent retriever. Over half of people who suffer from a stroke survive for more than 5 years, and more than 3/4 of people survive for a year. The patient's prognosis after an ischemic stroke is much more positive than after a hemorrhagic stroke. A stroke kills about 140,000 Americans each year. Someone in the United States has a stroke every 40 seconds. Every 4 minutes, someone dies of a stroke. Every year, more than 795,000 people in the United States have a stroke. Now I got some questions for you guys to answer. What is one of the main functions of the circulatory system? Name one important organ. Why is this organ necessary for the circulatory system? How does the circulatory system work with the respiratory system?